If you're in the ED and you see a patient who is undergoing shock, especially septic shock, you need to get a blood sample before you start antibiotics. This sample is very important as you can culture it to know if there is any organisms causing septicemia in this patient. And again, it's very important that you take this sample before you start IV antibiotics. After you take the sample, you can start broad-spectrum antibiotics like amoxicillin, for example. And as soon as you have the results of the culture, you should modify your antibiotic regimen to be associated with the culture. Cultures are also important to monitor the treatment. You should take cultures frequently to see if the patient is responding to treatment or not. It's also important in cases of fever of unknown origin. In these cases, you need to take cultures from the blood, from the urine, and from the sputum, and also from the wounds if the patient has any wounds. This lecture is part of the emergency medicine course. If you find it useful, you can check out the entire course in the link in the description. The course covers everything that has to do with the emergency department, including tests, imaging studies, common cases, and serious conditions. We also have a lot of cases and quizzes that you can take to test your knowledge. Just check the link in the description.